Hi, my name is Angela Wong, and this is my YouTube project for the Civil Rights Legacies class at SMU. So, I'm going to start out, of course, with a Trump montage.
7 years ago, congressional Democrats broke the American healthcare system.
Obamacare is a complete and total disaster.
It has been a nightmare.
It's imploding.
I predicted it a long time ago. I said it's failing. What's happening with the premiums and the increases of 100% and 120%.
You have deductibles that are so high that after people go broke paying their premiums, which are going through the roof, the health care can't even be used by them because the deductibles are so high.
Make no mistake.
Surprisingly, over the past couple of years, Trump has made it really plain and obvious that he's not a big fan of our medical industry. And the reasons that he gives are actually pretty justified. Deductibles and premiums across the United States are increasing. Now, the US Department of Labor actually estimates how much each person spends per year on their health care. For the average American, that number is about $4,612, and then for the average Black American, that number is about $1,794. So there's a difference of about $3,000 between the average American, including whites and blacks, and of course the Black American. There's a huge discrepancy in these numbers, not because Black Americans are getting some kind of subsidies or handouts from the government to make their healthcare costs cheaper. No. The reality of the situation is that Black people are facing a lot more obstacles from them getting care. There are a number of institutional factors that have prevented Black people from getting both the same access of care as well as the same quality of care. But I will touch more on that in my actual presentation in class. For the sake of this video, I'm going to be focusing specifically on 2 case studies of racism and how it has manifested to hurt both white Americans and Black Americans. Now, don't get me wrong, white Americans in the US, especially poor white Americans, are suffering considerably from health disparities. But I think a really good, interesting case study of this disparity can be really revealed in the opioid epidemic. So if you guys don't know, over the past couple of years, especially in 2016 and 2017, the number of deaths of white people, especially from opioid overdoses, is considerable. And the process of this kind of addiction really stems from the physician's office. So a lot of people who get hooked on heroin and opiates really start off by getting prescription painkillers from their doctors. The doctors overprescribe, people get addicted, they eventually find that they can't get their prescription as often or frequently as they would like, and some of them even jump over to heroin, which is a lot cheaper and easily accessible. I think a question that we should really be asking is, why is the opioid epidemic disproportionately affecting white Americans? And I think one of the real reasons why it has relatively left the Black community untouched is because of medicalized racism. What makes this issue racialized is in the first stage of the opioid addiction timeline, so inside the physician's office. Say, hypothetically, a poor white patient comes into the ER. A doctor will see them, no problem, write them a prescription for the painkiller, and that white patient is able to go on their way. Now, say, for example, we have the same situation, but the patient is Black. Now, in America, there's actually been a lot of studies about patient bias from the perspective of the physician. Physicians in America, regardless of the physician's race, are more likely to not believe the pain of Black patients. So whenever, for example, a Black patient comes into the ER, the physician is more predisposed to think that that Black patient is drug seeking. And because of that, a lot of physicians actually aren't prescribing Black people as much painkillers in the medical setting. So because of this health disparity, this racialized health disparity between dispensing painkillers, we now see a lot more white people being exposed to very strong painkillers like Vicodin, hydrocodone, and etc. If white people are more exposed to these kinds of painkillers, they are of course more likely to develop an addiction. So actually, in this case, medicalized racism actually hurt both groups. You see, for the Black Americans, they weren't prescribed painkillers when they needed it. For the white Americans, they were overprescribed painkillers, and as a result, this led to this huge opioid epidemic that is literally reducing the average American life expectancy over the past 2 years. Now, what I think makes this opioid epidemic case study really interesting is, of course, the medical response to the opioid epidemic compared to the 1980s crack epidemic. So in the 1980s, there was actually a huge crack epidemic, similar to the opioid epidemic, where a lot of individuals were getting addicted to a certain Schedule I drug But in this case, the people who were getting addicted were mostly Black Americans. Now, of course, there's been a difference in responses, and I think that's really indicative of medical racism as well. So the American Medical Association, which is like the godfather of physicians in the US, actually released a huge statement over here, stating a lot of different initiatives that doctors are going to take to combat the opioid epidemic. Now, what's interesting is that whenever the crack epidemic happened in the 1980s, there was no such press release from the American Medical Association. Essentially, they left that job of dealing with the crack epidemic, dealing with Black people, to law enforcement. So in 1986, Congress actually passed the Anti-Drug Abuse Act, which is the major piece of legislation in the United States that has instituted mandatory minimums. And if you don't know how badly the mandatory minimums have affected Black Americans, I think this study right here will be a really good one to look at. Basically, Black Americans are being jailed for up to 20 years at a time just for possession of things like marijuana. So what's really interesting is that when white patients are suffering, physicians are more likely to jump on board and to see them as people who need to be rescued and treated. But when Black Americans in the 1980s were suffering, they saw them as criminals, crooks, and of course crackheads, which is mildly racist. So I think a lot of people in the US really like to use the opioid epidemic as proof that racism doesn't exist, because white people are more disproportionately affected. But I think if you look deeper into the real facts of it, we really see that medicalized racism was a huge participant into why the opioid epidemic existed. And also, I think it really goes to show that medicalized racism really hurts a lot of people, even not just Black people. White people here were affected. So physicians really need to take it upon themselves to treat patients equitably, because in the end, we can have another opioid epidemic, we can have another crack epidemic, and we can have more people dying when they really don't need to be. So that's it. That's all I've got. If you guys have more questions, definitely let me know. And until then, I hope to see you guys in class.